Good morning, everybody, and thank you for joining us today. Again, I want to thank all the essential employees that keep us moving forward. To everyone out there, whatever your job may be, please, I want to let you know it's not going unnoticed, and we can't thank you enough for what you're doing day in and day out. To the people staying home and doing the right thing, thank you. Thank you. And, you know, one of the things I've said, this is about a partnership. It's about working together with people. We can agree to disagree at times, but we need to continue to have that dialogue, not finger point. People don't need finger pointing right now. They need solutions to the problem so we can reopen up. And we need to lean on each other because we don't get everything right. And you can learn from your neighbors in other counties in the state of New York. Fortunately, I have the opportunity of being president of County Executives of America, and you can learn from other communities as you talk to them. But Ripley County in Indiana was nice. They reached out, sent me a little email on the reopening plan. They said they tune in every day and watch what we're doing here from Indiana. So thank you for tuning in. Thank you for sending us your plan. And but that's how it gets done. We can't all have the right answers. We all want to protect everyone. And one of the questions they said, and I got to tell you, kind of overlooked it. They said, what are you going to do now that the nice weather's here? We're going to have all these garage sales. We have a lot of garage sales in our community in Indiana. And I said, you know what? I'll call you today after I'm done at the press conference because I don't think we addressed that. Didn't think about it. And that's what I said. We can't think of everything. And that's why I said to people sitting at home, be part of the solution, don't be part of the problem, and come up with things that we are not thinking of. Read through our plan that we put out yesterday, and there's something we need to add to it. Like garage sales, I got to tell you, I got to address that issue now because it's not in any of the phases. It's just something you don't think about. It's just something that, because we're looking at the bigger mechanisms and getting schools back online, getting businesses back, and the last thing you think about is garage sales. But a lot of people like to go out garage selling. You know, and people get extra money from that. So it's, you know, a neat way to interact with people in your community and outside your community. So I really have to look at that now. But thank you, Ripley County in Indiana, for pointing that out to me. But as of today, we have 1,455 people with positive cases of the coronavirus in Albany County. 772 people under mandatory quarantine. That's down from 80 from yesterday. And we have 6 people under precautionary quarantine. That's the same. And we only went up 4 from yesterday, and which is, you know, again, with the amount of testing that we're doing here in Schenectady County, Rensselaer County, in Albany County, working in conjunction with each other, I got to tell you, I'm so happy when we see that because it kind of shows we're going, we hit that apex and we're going down the other side. But it doesn't mean we can rush out this weekend. Thatcher Park was crazy. I drove through there. I couldn't believe the crowds. And it's great that people are getting out and getting fresh air, but you got to social distance, and you should be wearing masks. You should be wearing masks. We have 3,795 people that have completed quarantine, up 68 from yesterday. 974 tested positive for the virus and have recovered. That's 17 up from yesterday, which is also good news. We have 29 people that are in the hospital. That's down 1 from yesterday, with a hospitalization rate of 1.99%. It was at 2.06 yesterday, which is, you know, heading again in the right direction. 6 people currently in the ICU. That's down 1 from yesterday. On the average for the last 5 days, like I said, 4 days ago we were at 12, 17. We're at 16 average positive cases in 5 days, which is, you know, which is still good. And then again, I want to update you on our testing site numbers. We've done 1,198 tests at our mobile testing sites here in Albany County, our walk-up ones. Rensselaer County, and combined with that, we have an overall of 1,285. Out of all those, there have been 160 positive cases out of 1,285. I also want to remind people if they want to go to our mobile sites to be tested, it's by appointment only. Area code 518-465-4771. Area code 518-465-4771. You can also go to the website and see our times that are posted. And as always, for essential workers and for the drive-through at UAlbany, please go online. It's 1-888-364-3065. And again, you can go online there to make appointments. Our Colony Rite Aid site has done 1,313 tests so far, which is good. They've been very aggressive. When I get phone calls, people complaining about traffic lines, I'm okay with that, people. That means we're getting people tested and we're getting through. So I'm not going to answer that complaint. That's a good complaint to have sometimes when you categorize stuff when we, in our business when people say stuff to us. The Priority 1 Urgent Care in Gilliland, doing a great job. You can get the antibody testing done there as well. And yesterday, I highlighted our reopening plan as we look forward to getting the green light to open up. So I thought it'd be great in partnership to sit here with our two great Assembly people, Assemblywoman Pat Fahey and Assemblyman John McDonald, who I have to say this, I have such great dialogue since they've both been in office. They work hard for us. We argue a lot. We disagree a lot. We agree to disagree but keep talking. But I have to tell you, they pick up the phone every time, and whether they want to hear what I have to say or, I want to hear what they have to say, it's about working for the people. And we all work for the same constituent base, and we all are in this together. And I can't thank enough for these two partners to the left and right of me that work so hard. And John, who was mayor, hopefully I'm right, 12 years, City Coast?
13. But
all right, 13 years as the mayor of City Coast. So John gets it. He gets the pain the mayors are going through, the supervisors, the county executives, because he knows what it's like to have unfunded mandates or when you rely on state funding and federal funding and you don't know what's going to go on in the future, and you deal with the workforce and you're dealing with a population that needs services. And you have to prioritize that. But I can't wait to hear a little bit more. But as we struggle financially going into the future, our sales tax revenue's really been off. I think we're off $2 million on Monday. We're looking at what the inflation rate's going to be going into next year. And you have to remember the property tax cap is based on inflation. So if inflation's over 2%, say if it was 4%, we still can only raise taxes 2%. We can't go to the 4. So if inflation's at 0 or negative, we can't raise taxes, people. And that's what I'm advocating for, but it puts a real problem when you're losing federal dollars, you're losing state dollars. Where do you go? Where's the money come from? And you look at property taxes, and some of the issues we raised up to the governor's office and to other places was in our control room. And I've said it here. It's, I applaud the governor for doing no rent, for, holding people harmless during this crisis. But then I hear from landlords that are like, well, they're getting $1,000 a week or $1,100 a week. They should be able to pay the rent. I can't answer that question. I don't know. But what I have an issue with is at the end of the year, they're like, well, I'm not going to be able to pay my taxes. And that's going to be a whole other base of calculations of property tax money that we're not going to have coming in, which is going to affect not just me, every city, town, city, and village here in the county. And as we look for a stimulus package 5 to come out of D.C., and I know John and Pat been working hard with us when stuff going on in the state, it's going to be challenging times for everyone. When I've gotten the question about laying people off or furloughs, no, we're holding fast. I said we have to be part of the solution, not part of the problem. And if I started to, lay people off prematurely, started to do different things, and I'm not trying to scare my workers out there, it's just going to add more to the problem that we're in right now. Now's the time for us to hold fast, take care of the workers that have taken care of us in this county, and keep such vital services going forward. So I want to say to my workforce, thank you. But unfortunately, we got some difficult decisions ahead of us. I had multiple discussions with Chairman Andrew Joyce on this. We've gone back and forth, Wanda Willingham, the Chair of Audit and Finance, to a bunch of legislators that we're concerned, and we got to look at this going forward. But again, I want to thank the two of them for coming. So I guess it's kind of unique. I got both of you here, so I can really put you both on the spot. Being president of NISAC and County Executives of America, and then as county executive, to really have the opportunity to say how we're working together going forward. But I know you have difficult things going in the future with the state, with education. I hate to say this publicly again. I had to agree with Assemblywoman when she talked about summer school for kids and other things. And I said really nice things about her, but she said she didn't hear about it. So I was
so you have to repeat them.
I know, and I do want to say I do agree with her. We have to look at summer school to bring kids back and figure out how it's going to work for the fall if we want to make it work. But to John and Pat, thank you for being here. here, and I really, whatever you want to talk about the budget, state budget going forward, some of the issues that we've had, and I have addressed is in October, if the governor doesn't get bailed out the $60 billion or $65 billion now he's looking at, it's going to be pushed down to counties, and I'm looking for a partnership as we go forward, because I have to deliver my budget by the 10th of October, which I could this year. I want to thank Chairman Joyce for working with me in the Albany County Legislature to give me to November 10th, because not knowing what's going to happen with the state budget come October and how much pain it's going to be passed down by the state on unfunded mandates, it's going to hurt. One of the things I brought up, we can talk about is testing of employees and residents at our nursing home, which we've done in Albany County, but it takes time. It's taken us like 3 weeks to get through the whole nursing home. To do this twice a week at our nursing home would be a cost to us of $200,000 a month. It would be $2.4 million a year. For the remainder of this year, it'll be $1.4, and logistically, it can't be done. It's just nearly impossible. We've talked about this in the control room. I'll let them talk about this. But the other issue is that the Medicaid reimbursement was changed from DOH this year, so we lost $1.6 million in billable from our nursing home for next year. So now I got to, with this other mandate, I'll have a $4 million deficit going into next year, which again, on top of everything else, makes it challenging. So I talked enough. I really want to hear from the two of you. I'll defer to you first because you are my assemblywoman. I only got you part where I live. She's my assemblywoman. So
I got you. I'm good.
Thank you. Again, Assemblywoman Pat Fahey, County Exec. It's great to join you as well as my counterpart, Assemblymember John McDonald. And I want to reiterate a couple of things, but I want to start by saying thank you for the leadership and for your extraordinary hard work. You mentioned about when we talk, we don't always agree, but I have to say lately when you do return my calls, you always return my calls, but when you've returned them, they've always been after 10 o'clock at night or around 10 o'clock at night. So I know just how hard you are working. And you mentioned a whole host of others just a few moments ago. And one of the positive things, and it's good to start with the positive here, the level of cooperation here locally, whether it's the mayor, the town supervisors that I work with, and counties, Steve Aquario that you mentioned with NISAC, countless conversations with my upstate colleagues. The level of cooperation here locally has been extraordinary, and I think it's reached an all-time new level because we're all trying to figure this out. We're all trying to get those stimulus dollars, advocate for those essential, absolutely essential federal stimulus dollars, or the ripple effect of the coronavirus will be much, much more than health care. We know the devastation it's causing into the economy. The only way we can really begin to address this is having those federal stimulus dollars, especially with regard to the state budget, where, as you know, we're already $13 billion in debt. So really appreciate all your efforts on that. Totally echo your comments. You also mentioned a couple of other things, and let me mention those. Yes, I have an op-ed that I expect to be printed next week in the Times-Union regarding the summer slide. And traditionally, we see an academic summer slide, especially amongst more at-risk students. And now that is expected to be compounded by what I refer to as the COVID-19 slide. So yes, we need optional summer programming, be they camp, school, enrichment type activities. Again, all done in the most responsible way, all done at the option of parents and students as well as instructors, because we know we're going to need lots of help in order to do that. You can't just reopen the schools. You would need libraries and others. And again, if the data, that won't be everywhere in this state because certainly the entire state won't be open. But where we can do it responsibly with all the detailed protocols in place, I do think it would help so many students. Let's see. I also really appreciate your advocacy for trying to reopen the economy here locally in a responsible way as well. You and I have had many discussions about my concerns about small businesses. I'm very concerned about the economic devastation here with small businesses, and I trust them to act as responsibly as the big box stores that have been opened and have been serving the public in a very responsible way. So very anxious to get this data discrepancy sorted out with you, and I know we've all been working on that to make sure we get that addressed as soon as possible so that we can open. I would like to think phase that opening in the next couple of days, ideally. Last comment, the nursing homes. We're in regular touch with Albany Med and St. Peter's and others. St. Peter's oversees 7 nursing homes. It's in the millions what the cost would be. So for weeks, we were begging to get more assistance into the nursing homes, including more testing, more PPE, and what have you. So we appreciate the attention to nursing homes, but now it has to be in a reasonable way. Let's get everyone tested and then assess. But we need to find a level of reasonableness here and really target the problem areas. And we all know throughout the state we've had some real problem nursing homes. So we've got to test. Absolutely agree with that first round of testing, then target and trace. So that's there's plenty more, but I will stop there because I know I want to get to my colleague. And again, thank you for your extraordinary efforts and leadership.
No, thank you. And that's as quick as you've ever been. So I'm
got plenty more.
something with John McDonald. You got a lot more time than I thought you were going to have. But
That's good.
I do want to say thank you for your leadership, John. Seriously, and you've done a great job.
Yep. Dan, thank you, and it's a pleasure to join with you and with Pat. And thank you for your continued hard work during this. This has not been easy. I know, especially when we get into the fact of talking about people who've lost their lives over this. It hurts. It hurts an awful lot, and it takes a toll on everybody. And at the same token, we need to keep plodding forward. You know, we've been fortunate to work together now for almost 20 years, you know, and it dawned on me this morning when I was preparing. And this isn't our first rodeo, right?
Nah.
We 2001 wasn't pleasant. And you were serving our country.
Yep.
Well, you were serving our country for a long time, but particularly during that time. 2008, 2009 wasn't pleasant. And obviously, this is probably the granddaddy of them all. And at the end of the day, this is where experience, cooperation, and willingness for everyone to listen to each other plays a very large role. And you've been a leader in that aspect, and I really appreciate it.
Thanks, John.
Many individuals have said, geez, what are you guys doing? Legislature's not in session. And I will have to tell you, the issue I always loved in my business, what I loved as mayor, and what I love in this job is not actually the legislation, it's the constituent services. And the demand for constituent services has never been higher. The amount of individuals, and Pat will attest to this too, that we're working with in regards to unemployment is amazing. And it's been, on many different avenues, just a huge experience for everyone to deal with. Department of Labor is trying to do their best. I don't need to cite the numbers. The governor cites it on a regular basis of how high this is. And at the same token, still, people are getting lost in the system. And it might be because they don't have access to internet. They don't have phone service that will last them all month. And that's where, and it's not just our offices, it's our offices throughout the state where we're trying to make a difference. Pat referenced, and we both realize that the sooner we can reopen our capital region, the better we will be, and the sooner we will start to see some relief. We've been spending an incredible amount of time with our healthcare teams, particularly St. Peter's and Albany Med. I think people lose sight of the fact that Albany Med just doesn't serve the city of Albany. It serves 23 counties. It serves 3 states. And that's where we fall along the lines of we really are taking a very hard look and working with the administration and the Department of Health to really take a deep dive into exactly what are these cases in these hospitals and what impact are they having on why or why not we are not meeting the metrics. The 2 metrics outstanding run parallel to each other when
Correct.
you really think about it. And that's why we are pushing very hard at the state level, working with you and the other county executives and leaders in our region to make sure that we have accurate data, because once we start to reopen, I am confident that the residents of this region will follow the rules, stick to the guidelines, and at the same token, get back to work. Get back to work, start generating an economy again. The other thing that I wanted to mention also to reference is the nursing home situation. There'll be plenty of hearings and discussion about who did what and who didn't do what at some point, months, if not years down the road. The reality is this latest process in regards to twice-a-week testing. On the surface, it sounds good. I still contend, and I've been saying this for over a month, until the federal government is actually able to actually produce the tests, and being in healthcare, it's accurate tests that matter the most. There is such a rush to push out these EUAs, and now you're having companies, major companies like Abbott, that are now having their tests called into question in regards to accuracy. Until we get the federal government to produce those tests at a large enough volume to provide them for free to the state of New York, then the state of New York can distribute them to the healthcare providers to perform the test, I really would hope that we would give some consideration to putting a little bit of a pause or a delay on regards to the nursing home testing. The intention is good. No one's questioning that. It's the actual process of making sure that, you said Albany County, $200,000. St. Peter's, their nursing homes, $2 million per month. And at the end of the day, the processing of those tests is still going to be delayed potentially by 3 to 5 days. I don't know if we're going to really accomplish the goal. So I think we need to be thoughtful about that. On our level, most people don't realize this because a lot of our work's done quietly. We are talking to the Department of Health on a regular basis, talking to the InterGov folks, talking to the people on the second floor, saying, listen, we understand what you're trying to do, but here's what we're hearing from our providers and our constituents. We are very blessed in the Capital Region that healthcare is one of our 4 pillars of our economy. And then with that pillar also comes some very learned, experienced individuals that understand what the government's trying to do, but also can give us some real good, strong feedback on why we might not meet that goal. So I will stop at that because I know there's usually questions and answers, but once again, Dan, appreciate your leadership. I know this hasn't been easy by any stretch of the imagination, but you've definitely done a fantastic job throughout this process.
Thank you, John. I
Yep.
appreciate it. And hopefully now, after this, they won't confuse who we are. I was out at this event before this started, and this lady comes up and she goes, I have to tell you, you're doing such a great job, and I admire your hard work, and you're doing a great job in the assembly. And I said, yeah, I'll let him know, John McDonald, know that you appreciate him, but I'm the county executive. Do you appreciate me? And she just walked away. But that's okay. I'm used to that. That's all good. But, working together, and I've said this before, and not pointing fingers, we'll get through this. And people need leadership, and I can't thank the two of you enough because I truly do mean that. And I like joking around with both of you, but the reality is that we are working hard, and that's why I tell everyone, yes, you might not see what you're doing day in and day out,
right.
But I know you're out there in the community. I know you're trying to make a difference, and that has been an issue with unemployment. I know the governor's teams are working on that around the clock, trying to get more people on that. And it's easy to sit here and say, yeah, hey, bear with us and get it. When people are looking to put food on their table. So I get it, and we'll continue to move forward. I do want to thank, before we get into the questions, I do want to thank Majority Leader Schumer and Senator Gillibrand. Were able to get money to help with our health centers for the COVID-19 testing. It was announced earlier this week through funding through the Department of Health and Human Services. They were able to give Whitney Young over $400,000 to continue on with that testing going forward. So thank you to our 2 great senators. Can't thank Senator Schumer and Gillibrand enough. As always, our mental health support line is available 7 days a week, 8 a.m. to 8 p.m., area code 518-269-6634, and our 24-hour sexual assault hotline number, as always, 518-447-7716. Also, please call 211 or the New York State hotline, as always. They're there for you, and they're there to answer any question you may have. Please don't be embarrassed to call.
Dan, can I mention one thing?
Please, John,
There's just one thing I wanted to mention, and it's a thank you to you. As the testing started to become more expansive, and everyone was all, okay, we're going to go up to SUNY Albany. You didn't go to SUNY Albany. You went to the areas, particularly in the minority communities, where you knew access was going to be an issue. And as one who represents the lower wards of Albany, I truly appreciate it. And then you worked your way up the river to Waterville, to Cohoes. And, by the way, you've worked with the county executive of Rensselaer County, Steve McLaughlin, to also make sure that it expands to those urbanized areas as well. I think that's important. Another documentary of this COVID-19 will be the impact it has, particularly in the minority community and those who live in poverty. And those are the ones who are feeling the pain and the suffering more than others. But I want to thank you publicly, because it was long before anybody else started talking about it. You were there. Thank you.
Thank you, John.
Can I echo that as well? That's, Dan, I really appreciate it, because that is another one of the lessons learned, and we know that there will be chapters and books written about this for years to come, but one of the lessons learned is the health disparities and bringing the test to the people. The drive-through had always bothered me from the beginning. I live here in Albany, as you do, and we needed those walk-up sites urgently, so thank you for your attentiveness to that.
Thank
I
you.
will say, John McDonald and I, we do weekly town halls, virtual town halls. We had just done one on health disparities. And we know the Assembly has just done a hearing as well. There will be books written about this, but we know that is a problem. We have many wake-up calls as a result of this coronavirus, and one of the wake-up calls will be on the delivery of health care, the access to health care, as well as the American diet, let alone our supply chain that was woefully lacking. But back to the economy, I'd like to talk more about that and hear more about that, because as you said, we are way short. The comptroller just released new figures saying we went from 11.7 billion in tax revenues last year to 3.7 this year. That's an $8 billion loss in 1 year. Those are stunning numbers, and as you've said, they ripple right down through the entire economy. So thank you again on all of this. Really sobering information.
Thank you. I appreciate that.